Hi everyone, my name is Mike Cheney and I'm a respiratory therapist. And today we're going to talk about how to gather parameters on an intubated patient. Now, wherever you work or go to school, they may have a little bit of variance in what parameters actually are, but we're going to go over the basic ones today. And then I'm going to show you two methods of how to gather them. One using a parameter kit and the other one on the ventilator. All right, so let's start with the basics. We would use our right respirometer and we would count the respiratory rate and we would measure the minute ventilation, and from that we can get the average tidal volume. We can calculate that. These are very representative of what patients are doing at tidal breathing, but we also would gather a vital capacity and a NIF, negative inspiratory force, also known as maximum inspiratory pressure, both the same thing. And these, if you think about it, vital capacity, that's a much bigger amount of gas. You're gonna have them breathe all the way in and exhale all of that breath out. It's a slow vital capacity. And then that with the NIF or MIP, which determines how much strength they have, these two together will kind of give you an idea of what the patient has in them in terms of reserve, strength, and volume. And so even though they might be okay at tidal breathing, you want them to be able to, if they have to move around or do any activity, or if they have to take in a deep breath to cough, these two would be, of these indicators here, these two would be the ones that would give you the best idea about that. So something to consider when you're interpreting the values. These would be more at rest, these would be more reserve and strength. And then a lot of people will throw in a rapid shallow breathing index as their last one. And so respiratory rate, again, you may have different normal values. I'm just gonna kind of give you general ones. We typically like the respiratory rate below 25, minute ventilation between 5 and 10 liters per minute, average tidal volume, spontaneous, unpressure supported, just normal tidal volume should be a minimum of 5 milliliters per kilogram of ideal body weight. Vital capacity should be around 10 milliliters per kilogram of ideal body weight or greater. Again, some institutions vary that a little bit. They may say you have to get a different number of milliliters per kilogram or this many times the tidal volume, and that's fine. 10 is just a basic guideline. A NIF, we want negative 20 or more negative than that. And then an RSBI, which is rapid shallow breathing index. You can remember that by rapid is rate, shallow refers to volume. So that formula is respiratory rate divided by tidal volume in liters. So you want that to be less than generally 105. All right, let's go over to the lab and show you how it's done. All right, so this is the area where we're going to show you the parameter kit. Now, a lot of people, especially nowadays, because they put these functions on the ventilators themselves, a lot of people don't use these anymore. But it's good to have these in case that's all you have. Plus, if you're out on the floors on a non-intubated patient, you'll need to know how to work this parameter kit if you don't have an automated digital type. All right, so we have our parameter kit, already comes pre-packaged, and I have all the pieces out here, and I'll go over those. We also have our NIF meter, which is, measures pressure, and then we have our right respirometer. This is a really old one, but that will measure minute volume. Okay, if we get our minute volume and respiratory rate first, this parameter kit has some ports and things, and you'll see some variance in how people use these. I'll show you how I do it. This is a 15 millimeter inner diameter, which will fit in 15 millimeter outer diameter airway. So an ET tube, a trach, whatever you want to hook it to, it'll fit. By the way, if you wanted to do it on a spontaneously breathing person, you just put the corrugated tubing there, and then you can go get a mouthpiece from somewhere and use it that way. Of course, we put a filter in between there too. But we are doing an intubated patient. So These have two valves. One is on the outside and one is on the inside. And so think about, we hook the ET tube to the port here, and when they breathe in, air is going to come in through this side because the one-way valve is on the inside, and it can't come in through this side because the one-way valve is on the outside. So when they breathe in, air is going to come in this side but not this side. When they go to exhale, think about the air coming out. It will close this side and go out this side. So they breathe in through this side and out on that side. So we want to measure on the exhale side. So we can put a piece of corrugated tubing there and our filter and hook that right to our respirometer. Okay? And really important is to explain to your patient what you're going to be doing. So I don't use fancy words when I'm telling the patients what I'm going to be doing, because they're probably half out of it, they're uncomfortable, they don't feel good, they just want to get that tube out. They don't want to have to try and understand fancy words. So I usually just say, introduce myself and say, hey, I'm going to do some breathing tests with you and see if we can work on getting that tube out. And that's all they need to know. That's what they like to hear. So what you want to do is I tell them, first, I'm just going to take you off the ventilator, and it's going to feel pretty much like it is right now, assuming that they're in CPAP with a minimum amount of pressure support, which is probably the case in a patient that you're considering to extubate. And so you're going to gather your minute volume first. So I say, I'm going to take you off the ventilator, feel pretty much like it does right now. Now understand that one of the advantages of doing this on the ventilator is that they get to keep their FiO2. When you take them off, obviously, if they desaturate really quickly, that's something you need to consider. Might want to hyperoxygenate them or maybe do the parameters on the ventilator. But we're going to go ahead and hook it up here. And what you don't want to do is hold the respirometer like this, because that's the exhale side. And if you have it laying in your hand like that, even though it's very comfortable and you can see it, you will block the exhalation and affect the values. So I'm going to hook it to the patient and just tell them to relax, and you're just getting some measurements. And so we're going to hit reset. And I like to find either on my watch or a clock on the wall, I like to go ahead and wait until the second hand comes around to something I can remember, whether it's the 12, the 3, the 6, the 9, whatever. And as soon as it crosses that on the clock, I hit the reset button, and that way I'm starting. And as it's running, let me see if I can get this hooked up and give it some breaths here. Okay, so as this is running, you can see their respirations. And so what you're going to do is you're going to watch that clock for a minute, and you're going to count every time that needle moves. And once you get to the minute, then you're going to either click it off or disconnect it right away. So when you're done, you're going to pull it off and you're going to read the minute ventilation. Now this has two little dial areas on it. The inner one is whole liters and the outer one is the partial liters. So if we look at this one, you can see that the little one is just before the 2, so it's going to be 1 point something. And if we look on the outer one, it's right about at the 0.8. So that's 1.8 liters or 1,800 milliliters, whichever you want to report it as. I would do liters, 1.8 liters. And so that's that. Then you take that number and divide the respiratory rate into it. And that will give you your average tidal volume. All right, so that knocks out 3 of them right there: minute ventilation, respiratory rate, and tidal volume. Next, we're going to do the vital capacity. And if you remember, that is have them breathe as deeply as they possibly can in and blow that one breath out until you tell them to stop. And again, a lot of times I'll give them a break on the ventilator while I'm calculating the first 3 there. But I tell them, okay, the next one, we're going to take you off the ventilator again. and it'll feel pretty much like it does right now. When I tell you, breathe in as deeply as you possibly can and blow that one breath out until I tell you to stop. Now, if you tell them, take in a deep breath and keep blowing until I tell you to stop, a lot of times you'll get them doing these huffs, like that. So I like to specify, breathe in as deep as you possibly can and blow that one breath out until I tell you to stop. And I tell them to stop when I see that needle stop moving. All right, so we hook them up, we say, okay, breathe in as deep as you possibly can, and they breathe in real deep. And as soon as I think they're all the way in, I hit the button to reset, and then we have them exhale, 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 exhale. Now I have a little test lung here, so the machine, so it's not, I'm not pulling it up very far, but that's how you would do that. And you would just read your vital capacity. The next one is a little different. We don't use the right respirometer. And what we do is, now we're going to see how hard they can pull in. So when they pull in, remember, this side shuts and this side opens. So we're going to go ahead and hook our NIF meter to it. You can see the NIF meter there. So we're going to put this nipple in here. Now this can be really tight and difficult to get in there. This one's not, because I've already pushed it in there before. But if you need to, you can go ahead and put your parts and pieces in there, and that makes it a little easier. I'm just going to go straight into it for this one, and we'll hook our NIF meter to it. Now, if you think about it, when they breathe in, they're not going to be able to pull any air in, because this is going to close and they're going to be pulling through this tiny little tube, and this doesn't allow airflow through it. So I like to tell them that. I say, okay, I'm going to do a last test here, and I'm going to take you off the ventilator. It's going to feel pretty much like it does right now, and I'm going to see how strong you are. I'm going to see how hard you can pull. I say, so when I tell you, I need you to pull as hard as you can, and you won't be able to get any air in. I think that's really important to tell people, is they won't be able to get any air in, but it's only for a few seconds. Now, technically, the procedure is supposed to last 20 seconds. I don't ever do it that long. I think that's a really long time to deprive somebody of a breath, but there we go. So we just hook that up, and we say, okay, breathe in as hard as you can, go, 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 and you watch the needle go down. Ours is not working very well, but a lot of them will have a little stopper thing that will move the needle. Actually, here, and it is working. So we'll do that again. Pull, 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 and then it moves the needle, and it will hold your spot right there. So that would be -20, which would be minimally acceptable. And that's that. And the last one is the rapid shallow breathing index. And remember, we take our respiratory rate divided by our tidal volume in liters. So you're looking at, what you measured the first time, you got your respiratory rate and your tidal volume, so you can already make that calculation without doing anything else. All right, so that is the parameter kit. Now we're going to move to the ventilator. I want to make one more point here. Some people will put this whole parameter kit together and get their parameters with it together. So when they get their minute volume, they'll hook the right respirometer onto here, and they'll have the patient, breathe in and out, and they'll leave this nipple on here. And really that makes it so the patient has to breathe through that, and that's not very good. So some people will also open that, and instead of taking them off and on, they'll just plug or unplug that, again, leaving them kind of a small hole to breathe through. So, everybody has their own way of doing things. I like to go ahead and, disassemble it and let them breathe through something that's that size. Okay, we have a Puritan Bennett 980 here. Ventilators are going to vary a little bit in how this looks, but it's all basically the same principle. So we're going to get parameters, and if you remember from our other one, we are going to get our minute ventilation, tidal volume, respiratory rate, and RSBI first. So obviously the first thing we're going to do is put them in CPAP mode, no pressure support, otherwise it's going to give you faulty numbers. I think it's fine to leave a little bit of PEEP on, 3, 5, whatever you have on them. Certainly if there's a lot of PEEP, then you're probably not going to be doing parameters anyway, but you want to go ahead and put them in a spontaneous mode. or CPAP, and I have no pressure support. I'm going to leave my PEEP 3 on there, and then we're just going to go ahead and watch them. Now, in what to tell people, I think it's good, just like on the other parameters. I always think it's important to let people know when the ventilator is going to feel a little different. So I just say, hey, we're going to do some breathing tests on you. Going to let you do a little more breathing on your own. It's going to feel pretty much like it does right now, but you'll be doing a little bit more work. We're just going to get some numbers, see if we can work on getting that tube out. That's what I do. Everybody has their own, style. All right, so go ahead and, on this, we don't have to time it or anything because this is going to automatically give us our numbers that we need. So we have our respiratory rate, our tidal volume, our minute volume, and then if we drop this down, we can see our RSBI. Now they list it differently. It's F/VT, that's frequency to tidal volume ratio. And again, we want that less than 105. Okay, so we've gotten our respiratory rate, our tidal volume, our minute volume, our RSBI, and now we're going to get our vital capacity. So we're going to go into this menu here, and RM is for respiratory mechanics. We're going to go right there, and we can go to vital capacity. So when you and the patient are ready, tell them to go ahead and take in a deep breath and blow it all out. So we hit the start button, say, okay, get ready, breathe in as deep as you possibly can. In, and blow that one breath all the way out. Keep going, keep going, keep going. And there we go. And you can reject or accept it. I'm going to go ahead and accept that one. And now we're going to do our NIF. So we can close that screen. Just to remind you how to get back in. We're going to go to NIF. Now this one we have to hold it. So again, we're going to tell our patient, I'm going to see how strong you can pull. When I tell you, I need you to suck in as hard as you can, but you won't be able to get any air in, but it's very short. And so, ready, and breathe out, and hold the button, and pull, 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 and when you think they're done, let go. And there's our NIF. And we're going to accept that. And that is parameters.